plan.
Ratings are a lot lower than the president's.
Exactly. That makes sense. Just do the math, baby. Roy Blunt is joining us now. He's a congressman from Missouri. He's good enough to talk to us now. Congressman, thanks for being with us. I imagine the news that you're hearing, that there's problems here in the city, are ones you would have expected. But let me start you somewhere else and ask you, okay, what would your plan be?
Well, actually, that's the interesting thing about this debate, Rick, is everybody agrees on the top line issues. I believe, as the leader of our group on our side that's tried to bring our committees together to work on this, and I think we're in generally broad agreement. We need a plan that has, we need a health care system that has access for everybody regardless of pre-existing conditions, one that has more competition, more choice in a way that would make it more affordable, and one that ensures that people have the maximum opportunity to make their own choices about their doctor and their health care. So we agree on the goals, and our biggest disagreements are how you get there, and probably the biggest disagreement of how you get there is whether the government is going to run a plan that doesn't broaden competition, but actually eventually eliminates.
Well, you know, it's interesting, and I'll let you maybe discuss this with my colleague Sanjay Gupta, who's been giving this a lot of thought. And he says, or he seems to be suggesting, and Sanjay, I don't want to put words in my mouth, but maybe something in the middle may be the answer, right? I mean, because if you do everything based on profit, as you suggest, Congressman, well, that leaves you some holes as well. And we all know if you let the government take care of it itself, that may leave you some holes. Sanjay, would you suggest that somehow a mixture of the two would be the way to go?
Well, you know, I mean, there's several different issues sort of at play here. As far as a mixture of the two goes, people have suggested sort of a public-private option, and I'm not sure if Representative Blunt is referring to that specifically or how he feels about the idea of a public option. Let me lay it out this way. The public option would be for, you know, the way it's been presented would be for people who cannot afford health care, need some sort of subsidy, need some sort of other system in which they can purchase into to get their health care insurance. The concern, the critics will charge this, Rick. They will charge that a public option that has the backing of taxpayer dollars will be such a big competitor that we eventually sort of remove the private insurance industry altogether, and that won't be any kind of competition at all.
Well, let's hear from the congressman on that. What do you make of that,
Rick,
sir?
You know, and of course, I think you said it a moment ago that I was for a system based on profit. I'm actually not. I'm for a system based on competition, which is different than a system based on profit. And I think,
aren't they the same? Aren't they really the same though? I mean, you compete because you want to do better than the next guy.
You want to have some profit, but you don't want to have profit that the marketplace really shouldn't allow. That's the problem with the current system.
Okay.
It sort of grew up out of nowhere after World War II without any thought to really having maximum choices for people. An example of maximum choices for people would be Medicare Part D, where everybody every year gets to look at their provider and decide if they still like that provider or not. But back to Sanjay's point, you know, I think many of us could accept the idea if at some point the competition we're confident would be there doesn't materialize and these new choices can't be developed, you visit this again. But if you start out with a government competitor, nobody describes this as just a competitor for people who can't get insurance. The idea of the government competitor is to somehow make the marketplace more competitive. But what happens is that government competitor eventually drives all the other competitors away. A government competitor is like an elephant in a room full of mice. And the fast mice get out of the room as quick as they can. The slow mice get crushed by the elephant, and then the only thing left in the room is the elephant, and then you have government-run health care, which is what we don't want. We want more competition. We just don't happen to think the government trying to run a big health care operation is the best place to give people more choice, more competition, and actually ultimately lower prices with better health care.
That makes sense. We appreciate the analogy with the elephant. We certainly understand that. Quite vivid, in fact. What do you expect the president to come out and tell the American people in the next 5 minutes?
You know, I think he's going to try to explain these numbers that the Congressional Budget Office came up with that really say that this isn't just $1 trillion over 10 years, it's actually $2 trillion over 10 years, because the first 5 years, no money's spent. The second 5 years, you're spending almost $200 billion a year. That's not anywhere close to being paid for by either tax increases that have been proposed in this bill or Medicare cuts. And surely he'll try to explain why both his own Office of Management and Budget and the Congressional Budget Office are wrong in saying this does nothing to slow down the spiraling health care costs. There were two goals supposedly here. One was to get people insured who aren't insured, and two was to stop the spiraling health care cost. And I don't think this program does either of those, but it sure costs the American taxpayer and the American economy a lot of money.
Well, you know, this is starting to get somewhat curious because we were told the president was going to be coming out and speaking at, pardon me for looking over, but we were told in more than a half hour ago, 3:15, we were told the president was going to come out. It gave the appearance that the president was the White House was kind of scrambling to get the president's message out on this. And
Right.
now we're more than a half hour, 37 minutes to be exact, past the deadline when we expected him to speak, and still no signs of the president. We're going to continue with this conversation with Congressman Roy Blunt, Dr. Sanjay Gupta, and Dana Bash as well, to bring you the very latest information coming out of Washington on what seems to be a developing story that we're still waiting to get the climax on. And that's the President of the United States and what he has to say. That's next. Stay with us.